On February 19, 1994, a seemingly ordinary night unfolded at Riverside General Hospital in California. It was around 8:15 p.m. when paramedics rushed a critically ill woman named Gloria Ramirez through the emergency room doors. Gloria, a 31-year-old mother of two, was battling advanced cervical cancer. She was weak, confused, and struggling to breathe. Little did the medical staff know that this night would be etched into their memories, forever shrouded in mystery. Gloria's family anxiously watched as doctors and nurses worked tirelessly to stabilize her. They described her condition as dire. She was critically ill and clearly in need of immediate medical attention. Time was of the essence as the medical team fought to understand the cause of her deteriorating health. Unbeknownst to them, this was just the beginning of a bewildering and terrifying ordeal. As Gloria's vitals plummeted, the medical team sprang into action, administering a cocktail of drugs to combat her symptoms. They drew blood, hoping to glean any insight into the cause of her rapidly declining health. But as they examined her blood, something peculiar happened. A strange ammonia-like odor, pungent and unfamiliar, wafted from the vials. It was an odor that sent chills down their spines, an odor they couldn't quite place. Confusion rippled through the room as the medical staff exchanged uneasy glances. What was this inexplicable smell? Could it be related to Gloria's condition? The questions lingered in the air, thick with the unknown. The staff continued their desperate attempts to save Gloria, but the situation was becoming increasingly bizarre and unsettling. The pungent odor intensified, and soon medical staff members began experiencing their own alarming symptoms. Nausea gripped them, their stomachs churning uncomfortably. Some felt a burning sensation in their eyes and throats, while others complained of dizziness and headaches. The once organized chaos of the emergency room descended further into disarray. As more people succumbed to the mysterious illness, panic set in. The hospital initiated emergency protocols, evacuating patients and sealing off the contaminated area. The sick staff members, struggling to breathe and overcome by nausea, were rushed to the parking lot for fresh air. Fear and confusion reigned as everyone wondered what was happening, what was in the air. Amidst the escalating chaos, Gloria Ramirez's condition continued to deteriorate. Her heart, strained and faltering, beat its last. Despite the heroic efforts of the medical team, Gloria Ramirez was pronounced dead at 8:50 p.m., less than an hour after her arrival at the hospital. But the mystery of her death and the illness that swept through the emergency room was far from over. The events of that night left an indelible mark on all who were present. The strange odor, the sudden illnesses, and the tragic death of Gloria Ramirez created a chilling puzzle that demanded answers. What had happened in that emergency room? The search for answers had just begun, and it would prove to be a long and winding road. Curious for more? Like and subscribe for more interesting unsolved mysteries.